Welcome to this special Gastro Girl podcast. This episode was produced in collaboration with the American College of Gastroenterology's Patient Care Committee. Here's your host, Jacqueline Gaulin.
Hi, everyone, and welcome back to the Gastro Girl podcast, your trusted resource for digestive health education, expert insights, and patient-centered conversations. Today's episode is produced in collaboration with the American College of Gastroenterology's Patient Care Committee, and we're so grateful for their partnership in helping bring you evidence-based, patient-focused information. I'm your host, Jacqueline Gaulin, and I'm thrilled to welcome Dr. Lisa Strate, Professor and Chief of Gastroenterology and Hepatology at the University of Wisconsin and one of the leading experts in diverticular disease. Today, we're unpacking everything patients need to know about diverticulosis and diverticulitis, two words that sound similar but mean very different things. And that's where we're going to start because it's one of the biggest areas of confusions for patients. Welcome, Dr. Strate. So happy to have you on the show today.
Yeah, thank you for having me. I'm excited to talk more about it. I think we need to get more of the current information out there.
Well, one of the first questions I'm going to ask, because I know patients are constantly confused by this, what is the difference between diverticulosis and diverticulitis?
Perfect way to lead into this. It's a very confusing terminology. So diverticulosis is the condition where individuals develop pockets, little sacs in their colon. And that condition is very common and generally not symptomatic and not harmful. And we can get into that later, I think. Diverticulitis is a condition where one or a few of these pockets become inflamed. And that's an actual clinical condition that we do diagnose and treat. So diverticulosis is necessary to get diverticulitis, but one is very common, and then the other one is a little less common manifestation.
So can someone have diverticulosis their whole life and never have a problem?
Most people. Yeah.
Oh.
Only about 2% or 2 out of 100 people with diverticulosis will ever develop a problem.
Interesting. So what causes these conditions and who's at risk?
We're learning more about it. We don't have all the answers. We do know, and what has stimulated sort of the direction of research is that individuals in Western or developed countries are much more likely to get both diverticulosis and diverticulitis than individuals living, let's say, in Asia or in Africa. And so initially it was thought that it was all our behaviors, and that certainly is partly true. But now we understand the disease as being roughly 50% inherited. It's the genes that we inherit that predispose us both to developing these pockets and then probably different genes that predispose those pockets to becoming inflamed. And the other half is our diet and lifestyle. Mainly, we understand that diet and exercise and our body weight all play a role in the likelihood that someone will develop these conditions.
And this might be a crazy question, but how does it manifest? Like, what causes those pockets? Like, is it erosion of the tissue? Is it, something eating away? Like, how do we visualize what's happening?
Despite the fact that this is so common, we don't know a lot about it. The current understanding is that it's tissue laxity, that someone would inherit genes that make their colon tissues more likely to herniate. And very technically, the colon is made up of two sets of muscles on the outside that allow it to push stool through and to move, kind of like a woven basket. Some of those muscles go lengthwise and some go around.
Yeah.
And if you can imagine that you could poke your hole through a loosely woven sweater or basket, the same thing happens with the tissue on the inside of the colon. It protrudes or pushes out between those weak spots. And the going thought is that it's because some individuals have sort of weaker tissues or bigger gaps in those tissues. We don't really understand, but that allows that tissue to herniate out. It used to be thought that bowel habits, constipation, low fiber are kind of the predominant thing, but there's some conflicting evidence there. So we think that constipation and a low fiber diet may not play a role or don't play as large a role as we once thought. It's probably underlying tissue laxity.
That's very interesting. So would someone say, oh, is there something in my lifestyle that I did wrong or something that I ate or didn't eat that caused these possibly?
Yeah, we know less about diet and lifestyle and the development of pockets themselves, in part because they develop over the course of a lifetime. And when you want to study something that contributes to something else, you need to know what someone's doing before they develop that condition. And because this is an asymptomatic condition that most people are walking around with, it's been really hard to tease that out. We do think that being overweight, smoking probably contributes to the tissue laxity. In terms of diet, it's somewhat less clear. We know more about what things that we do in our day-to-day lives contribute to diverticulitis, the inflammation of some of these pockets, than we do about what contributes to the pockets themselves.
No, that's interesting. And like you said, it can be asymptomatic. So maybe people are diagnosed when they have a colonoscopy at 45 and they see some of those pockets they may not know, and they see on their report diverticular, or they found a couple of these. So so once we get through the fact that we don't know if there's any signs and symptoms at first, it's going to progress a little bit. And then you may have warning signs, like I guess when it progresses from just being diverticulosis.
Well, okay. It's very controversial whether these pockets themselves without inflammation lead to any symptoms. Data are very mixed. So as we get older, we're more likely to develop these pockets. And it's likely that more pockets develop over time in someone who's going to get diverticulosis. But the going thinking is that if you just have these pockets, you should have no symptoms. And that, yes, you'll get a colonoscopy and someone will say, look, you have this, but you would never have known that unless someone looked at your colon, either via colonoscopy or there are a number of X-ray or imaging tests that can pick it up. And so although you might develop more pockets over time, that we don't know necessarily that means you're more likely to develop diverticulitis. Probably there's some really early evidence from a couple studies that suggests that the more pockets you have, the more likely you are to develop complications. But to go back, most people don't progress. Only 2% out of 100 people who have these pockets will ever get diverticulitis. So just because you had a colonoscopy that shows these pockets does not mean you're going to progress to get diverticulitis. 98 times out of 100, you'll never have any problems.
Well, thank you, Dr. Strate. I think that's important to note. Now, for those who may be listening, who may be in that 2% or have a family member, what are the signs that they may feel?
Exactly. Yeah. So when you progress, it would be, and I don't know if I guess you call it progress, but diverticulitis is the inflammation of one or more of these pockets, and it presents with usually the fairly acute onset of abdominal pain. In most people, that pain is located in the left lower part of the abdomen. Usually the pain is located in like a focal spot. So, a spot maybe this big or so on the left side. And some people it builds up over a couple of days, and other people, they all of a sudden get severe pain. And in most people, the pain is significant enough that someone says, something's different, something's going on. I need to call my doctor, go to the emergency department. Other than pain, some people feel nauseated, although vomiting is rare. Some people feel fatigued. Some people get a low-grade temperature or feel kind of like they have the flu. Some people get diarrhea. Some people get constipation. But the overreaching predominant symptom is pretty bad pain on the left side. And
unfortunately, with GI conditions, this could mirror lots of different diagnosis. But say for the sake of this educational information, if they go to the ER, how would it be diagnosed? Would they have to do another scope, or how would they know what was causing this?
Yeah, we don't usually do a colonoscopy at the time for a number of reasons, but a CT scan is the gold standard. We say the best test. Sometimes, especially in more remote settings or in a primary care's office where there's not a CT readily available, it can be diagnosed just based on clinical symptoms. Although we know from the literature that we're not right all the time when we just say, oh, you're 60, you have pain on the left side. If we guess right about 60% of the time. So a CT scan, at least for the first episode, is the best way to diagnose it. That doesn't mean that some people have recurrent episodes that every single time they have pain, they need another CT scan, because that can end up being a lot of CT scans.
Yeah.
But definitely the first time guidelines, although there aren't great data, recommend someone get an imaging study, mainly a CT scan on that first time, just to say, yep, your symptoms fit. And now we know on CT scan that this is what you have.
This is really complicated. It's not an easy, it's not an easy, like, okay, this is what you have. It could be or it couldn't be, but the scan will definitely show what's happening for patients.
For the majority of people, yes.
Okay. So what happens if diverticulitis goes undiagnosed or untreated? Can it become dangerous?
That's a good question. It's actually over the last 10 years, there's been a lot more research into how to treat it. And in big sort of the best standard of study is a randomized trial where you take half of people who present with diverticulitis and you give them treatment and the other half no treatment, basically, but which has been done in a number of studies. So this typical treatment is antibiotics. And in these studies, they gave half antibiotics and half not in people who present with what we call uncomplicated diverticulitis, more run-of-the-mill diverticulitis. And actually, those groups did the same. They recovered in the same period of time. They had the same number of complications. A lot of diverticulitis now we don't actually treat other than to say, take it easy. Don't eat a lot of food if you're not feeling well for a few days, and it tends to resolve. People who have more severe diverticulitis, I would say most of those would feel badly enough that they would show up in the hospital, but then there could be some serious complications if they did not get care. But that's a smaller group of patients, somewhere between 10 and 15% of patients that have an actual infection outside of their colon or other complication as a result of diverticulitis. And then, yes, going untreated people would not do as well.
Yeah. So you said for treatment, there's antibiotics. What about the role of diet and prevention? We always hear, you can't eat seeds, nuts, and popcorn. Is fiber good or bad? And we have patients saying this all the time, but we would like your insight on what is actually fact versus fiction here.
Yeah. Diet in this disease is confusing for a lot of patients, because what we tell patients to do when they're having an actual episode, which is like the typical diarrhea brat diet, bananas, rice, applesauce, and tea. We tell people when they have diverticulitis, not in between, not to prevent, but when they're having it, take it really easy because your system is inflamed and we just want to rest it. That's very different from what we tell people to do to prevent diverticulitis from happening. And usually that target audience is individuals who've already had an episode. People could do it just because they know they have diverticulosis, but their chances of getting diverticulitis are low. But so what we tell people to do to prevent an episode is basically a healthy diet and lifestyle. So we want a lot of fiber. We want not very much red meat, not very much alcohol, no smoking. We want individuals to the lower your body mass index or sort of your height to weight ratio is, or the more healthy that is, the less likely you are to develop diverticulitis. And then the more physically active you are, especially if you're doing exercise that makes you sweat and huff and puff, you tend to be, and these are in populations that we've studied, tend to be less likely to develop diverticulitis. And that can play a big role. If you look at individuals who eat the recommended amount of fiber, don't eat a lot of red meat, exercise, have a healthy body weight, and don't smoke, their rate of getting diverticulitis can be reduced more than 50% compared to the background population. And the good thing about that is all of those things are so healthy for your risk of cardiovascular disease, diabetes, cancer. And I feel like because diverticulitis is something people definitely feel when they get it, it's often a time to motivate people to make a lot of changes in their lifestyle.
Have you seen that in your practice? It's like a wake-up call for people. That's great.
Yeah. I mean, I think when people, especially if they've had more than one episode and they have a number of risk factors, I also think when people eat healthfully and they exercise, they feel better in general. And so it can be kind of a self-perpetuating thing. Once you get someone motivated and they start to make changes and they sense how much better they're doing, they can keep up with it.
Now, is there a stage where patients would need to worry? And again, I know you said this was rare, but if they need hospitalization or potentially surgery, what does that look like?
Guidelines for surgery are ever evolving. This used to be a disease that many people had surgery for because the thought process was that as you go along, it's going to get worse and worse. And now we understand that's not true, that people, if they're going to have one of these serious complications, it's going to be in the first couple of episodes. The surgeons talk about how scar tissue forms around the colon, and we think that's sort of protective for complications over time. But for whatever reason, these sort of complications that would require someone to be in the hospital, or even more rarely to have emergency surgery, happen early in the course. It used to be that anyone who had a complication was recommended for surgery, and even now it's more nuanced than that. So people who need to have surgery are generally those who get a large abscess, which is a collection of infected fluid outside of the colon.
Okay.
And many of those people, but not all, will require surgery. Sometimes in bad diverticulitis, there can be a connection that forms between either two loops of colon, or colon and intestine, or the colon in the bladder, or the colon in the vagina, and those generally require surgery. And then the last but much more nuanced category is individuals who have repeated episodes of diverticulitis to the point where it's affecting their day-to-day life. Then we consider recommending surgery for removal of the, usually what we call the sigmoid colon, to decrease the chance of that happening over time.
Okay.
So if someone has these episodes and they think that they might need surgery, it's really a good idea to talk to a gastroenterologist and a colorectal surgeon who can really think about this, because it's not a black and white issue for many people.
No, thank you for pointing that out, because like most things, especially in GI, it's not a one size fits all, that every case is unique. And, the reason why we enjoy doing these episodes is that we're really giving patients information that they can take to their providers to make informed, shared decisions on their health journey. So,
and yes, in this disease, it's most often a pros and cons discussion, and the pros and cons, different patients rate those pros and cons very differently. So it does have to be individualized, and that's what the guidelines now say, which is tough because it's easier as a provider to say it's definitely this or definitely this pathway. But in this disease, many times it comes down to that discussion about what are your expectations? How is this disease affecting your life? What kind of surgical candidate are you? What are the risks of surgery for you? And then balancing all of those out.
No, thank you for that. To summarize some of these important points, how can patients, you kind of touch on this, but I just like to give a closing list for patients to remember, is how can patients manage their symptoms, lower risks, and stay healthy?
I think lower risks of diverticulitis is the one where there's the most data, and I think patients can manage their disease the best. And that's, again, following a healthful diet and lifestyle. Diets like the Mediterranean diet meet those criteria. But more specifically, we know that dietary fiber, which doesn't mean fiber supplements. Fiber supplements play a different role. But here, we think that dietary fiber has so much, like fruits and vegetables contain so much more than fiber, micronutrients, minerals, etc. So a diet high in fruits and vegetables and legumes and nuts and seeds and whole grains, a diet where it's heavy on either vegetable sources of protein or fish and chicken, and lower in beef and pork and lamb, meaning ideally fewer than 2 servings a week, definitely fewer than 4 servings a week of red meat. So that's kind of the dietary part of it. Then the lifestyle is exercising 5 times a week, vigorously, optimally, something that really makes you sweat and huff and puff. keeping your body weight in a healthy range. And that's something you can speak with your healthcare provider about, calculating your body mass index, avoiding heavy alcohol use, particularly liquor, and not smoking. There are a couple of other things. We know that non-steroidal anti-inflammatories, which are things like ibuprofen, that are very helpful for pain, especially aches and pains in the joints. But we know that use of those does increase the risk of diverticulitis. So as much as someone can move to some other forms of pain control can also be helpful.
No, thank you for that. That's so important to note. Did we miss any myths or misunderstandings that we should clear up?
Two, I think, that are really prevalent. One is that nuts and seeds and popcorn and corn are bad in this disease. All of those are nutritious foods that are high in fiber and other healthful ingredients or compounds. And we know from 2 large studies now that nuts, seeds, popcorn, the seeds that happen in strawberries and berries are not associated with an increased risk of diverticulitis. So I know that's a myth that's been perpetuated for 70 years now, based on zero data. And I've done a lot of digging in the literature. It used to be thought that these pockets of seed might get in there and cause some problems, but there are no data to suggest that that happens. So people don't need to back off on those foods. There's still patients I see that insist that when they eat them, they get problems. And if that's the case, you should avoid the foods. But, they're so prevalent in a healthy diet that if people don't have problems with nuts and seeds and popcorn, they can eat them. And the other one is constipation. I think people get nervous that they have to have a bowel movement every day or they're going to get diverticulitis. And the data actually suggests the opposite, that the more bowel movements a person has per day, the more likely they are to get both diverticulosis and diverticulitis.
Interesting.
So people don't need to be like, oh, I need to take a laxative today because I might get diverticulitis if I don't go to the bathroom. That's not true.
Oh, thank you for that. Those are so important. So important. And then final message of hope or reassurance for patients who may be listening today.
One thing I haven't mentioned is that there are people who have diverticulitis and they blame themselves and they're doing all the right things. Just to point out that 50% or so of the predisposition to these both diverticulosis and diverticulitis is inherited. And you can't change your genes, not at least maybe someday with our modern technology. But as of now, unfortunately, that's sort of the bad luck of having gotten the genes that predispose you to these conditions. I'm not recommending that those people don't try to lead the healthy lifestyle, but that they shouldn't beat themselves up if they're doing everything they can. Sometimes this is not something they can prevent with diet and lifestyle. But the flip side is that we know that on the average person who follows these diet and lifestyle, who's already had diverticulitis or is predisposed, you really can impact your risk. And you can also make yourself feel better and be at lower risk of so many other disorders, not just GI disorders. So I think there is a lot of hope, and there's a lot more research in this field now. So in the next 10 plus years, we should be discovering even more things.
No, this is great. Any thing you want to give us a little insight on in terms of the research? What are they looking at?
Yeah, I think the next frontier is studying the genetics and the mechanisms that contribute to this disease. We already know that the microbiome, or the bacteria that live in our gut, play a role. And the better we understand that, the better we can develop means to change the trajectory of this disease. So I think there'll be a lot more research into the nitty-gritty of why this happens. And then once we understand that, we can start to target therapies better.
It's so exciting. And, this is there's so much misinformation around this topic. And I appreciate your coming on today and sharing and clearing up some of the misconceptions that we may have out there. Thank you so much for helping to break this down in such a clear and compassionate way. Your insights really help patients. They'll really help patients feel more informed and less anxious about these conditions. We also thank the American College of Gastroenterology's Patient Care Committee for collaborating and co-producing this episode with us. And for more resources, visit gi.org or gastrogirl.com. And don't forget to like, subscribe, and share the Gastro Girl podcast with your friends and family. And so you never miss an episode. And until next time, remember, you're not alone in your digestive health. Dr. Strate, thank you so much for joining us.
It was wonderful. Thank you for this opportunity.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.